The chair recognizes the gentleman from Georgia.
I thank the chairman, and I think that we've made some significant progress in the area of improving health care in this country, the laws related to health care in this country today in this chamber. This is another portion of an amendment that would address the issue of health care. As a physician and dad, I care greatly about the issue of health care, and came to Congress, frankly, as one of the major reasons was to try to fix the health care system and to make it more patient-centered. Over the last 2 years, we've seen a significant affront to our health care system, with the costs increasing, destroying jobs, violating principles to a significant degree as it relates to health care. Last year, this Congress made a lot of decisions that gave Washington control over our health care system, and a perfect example of that control is that ObamaCare mandates to the companies that provide the health coverage for individuals, helping individuals, how to run their business. Essentially, the federal government is in the business of dictating to private companies what they should do to run their business, what kind of coverage they can provide, what kind of prices they can charge, and what kind of definition of quality care and what meets the definition of essential services for individuals. It really is central planning at its finest, and it is certainly not the government's role in a free market system. The government's already proven that it's not well qualified for mandating and defining what will be counted as quality improvement activity for the purposes of calculating, in this instance, the medical loss ratio. For instance, many of the fraud provisions that are required are excluded from being included in the medical loss ratio. The coding system that is required for health insurers to utilize is not able to be included in the medical loss ratio. So what it does is compromise the opportunity for brokers to provide the best advice to citizens. It makes it so that these folks are actually, they're actually the exchanges, Mr. Chairman, if you think about it. But these folks are going to be pinched and pushed out of their jobs. The ones that are actually helping our citizens to weave their way through the morass of health coverage in this country. The President said famously during this whole debate, if you like what you have, you can keep it. The fact of the matter is, as you know, Mr. Chairman, and so many others know, that simply is not true. These medical loss ratio requirements will, in fact, break that promise to a further degree. So the amendment is very simple. It makes it so that no monies in this bill can be utilized for the provision for enforcing the medical loss ratio, destructive provisions in the area of health care. I urge my colleagues to back the amendment, and I reserve the balance of my time.
The gentleman reserves his time.